Good afternoon, ladies and gentlemen. Welcome to Inside Macomb. My name is John Gwynn Prosser II, and I am your host for today's show. Mr. Ted Wabi is presently unavailable. Our special guests today are Mr. Mark Ohala, the President and CEO of Mount Clemens Regional Medical Center, and Mr. John Cornack, the President of Eisenhower Rehabilitation Center in Ann Arbor, and the President of the Coalition Protecting Auto No Fault. We're going to cover a lot today, and we'd like you to get your pencil and paper handy so you can write down a couple of websites if you're interested in drilling down and gaining more information. Our topic for today is the assault on the auto no fault law by the insurance companies here in Michigan via House Bill 4936, which seeks to drastically alter, if not destroy, what the Insurance Institute itself hails as the finest model in America. During today's show, we will cover this proposed bill and its terrible public policy proposal, which is designed to create greater profits for insurance companies on the backs of citizens and healthcare providers. We encourage you as a viewer to visit the following website, dothemathmi.org. Do the Math, MI, short for Michigan.org. And that's the website for the Coalition Protecting Auto No Fault here in Michigan. And when you go there and visit all of the information that's available, we're asking you to take action and contact your state representative as well as Governor Rick Snyder and insist that they vote no on House Bill 4936, and then insist that your legislator compel the insurance companies to provide full disclosure and total transparency regarding their assertions of the unsustainability of our MCCA. MCCA meaning the Michigan Catastrophic Claim Association. So gentlemen, thank you very much for joining us here today on the show. I have some questions for both of you, and I'd like to start with you, John. Why do we need full transparency, John? What do you believe the insurance companies are hiding?
Well, we need full transparency first and foremost because people are going to get injured, especially in this new year. In the year 2012, we know there's going to be 500 plus people that are catastrophically injured in the state of Michigan. And that fund is going to take care of those folks in the long term and in the short run as well for the hospitals. So that's probably the most important piece. People are going to get in accidents and they're going to be injured. And we, the state of Michigan, want to take care of them. And you can't do that with how they're doing it in other states and other traditions. So that's first and foremost. That's what I want to say over the whole audience base. Second, I believe that the insurance companies are hiding things because of how they're doing their statistics, their methodology, their parameters of how something is sustainable. It's 13-point-something billion dollars of cash that's sitting there waiting to take care of these claims. No other state has that. And it's a phenomenal way of taking care of our own consumers. It's us paying for ourselves. It's the actual consumer paying for their health care down the road in case of a catastrophic injury. So the insurance companies, they just want to make sure that things are sustainable, so there are parameters around there. We don't know what they are exactly. That's what we've been asking for. That's the issue about transparency. It's let us know how you're coming to these numbers so we can help you if we have to make adjustments in the healthcare field. They are slow at forthcoming with that information, and we'll continue to ask, how are you coming up with the sustainability issues that we're going to run out of funds in the very near future when we know that right now you're charging us a fair amount, we're paying that fair amount, and that risk is ours. We pay for that.
Excellent. Now, Mark, as the CEO and the president at Mount Clemens Regional Medical Center, which is a level 2 trauma center, how will this bill impact your facility?
Well, if the bill that's currently on the table were to pass through the legislature and get signed by the governor, it would have huge negative consequences to our organization, and I suspect any other trauma-designated facility across the state. There's a couple of major points that I think people need to understand, and that is the first thing is that I think the insurance companies are painting a picture that they somehow are paying dramatically more than any other insurance company, whether it be Blue Cross or Travelers or Aetna, for healthcare payments to hospitals, and that's just not true.
Right.
The biggest misnomer is that when we send a bill out for a trauma case to an auto company, they negotiate what they pay us. And on average, the typical auto insurance company pays us 60% or less of what we actually charge for the service. And that is very, very similar to what the other insurance companies pay for us for any of the claims that they have. So that's kind of the first misnomer. The second thing is what they want to do is in the changes in the bill, they want to say you no longer negotiate with the insurance companies for payment. Hospitals, we want you to accept what is currently listed as a workers' compensation fee schedule. Well, the problem with that is the workers' compensation fee schedule was never devised to be able to take care of and pay for major trauma cases. If you're in a high-speed motor vehicle accident where there's multiple cars involved, multiple injuries, and significant trauma, those patients were not the same as the kind of workers' comp claim that you would see come in, who is a less intensively injured person and tends to be a lower level of acuity than the trauma cases that we care for. So in our particular case at Mount Clemens Regional, and again, we are the only verified trauma center in Macomb County, if they pass this bill, we'll have to think very, very seriously about terminating our trauma services, because we have a lot of incremental expenses that are unique because we have this program. And I'll give you one very specific example.
Great.
Our program has in-house ready for any patient that might come through our ER doors, trauma surgeons who are in-house 24 hours a day, 7 days a week. We have them there and we pay them to be there because that's the level of care that we need to offer as a trauma center. But we pay them whether we have 10 patients who come through our doors or no patients who come through our doors. So that cost, which is in excess of $1.2 million a year, that cost is there no matter what happens. And we need to be able to recoup that cost in order to keep the trauma service functional and financially feasible. And if we can't negotiate payment rates with the payers, what workers' compensation fee schedule would pay us is a very small fraction of what we currently generate. And quite honestly, the workers' comp fee schedule would cut our total payments to the hospital by nearly $4 million a year. And that's 50% of our operating margin.
That's drastic. Now, I'm certain that your perception of work comp as a fee schedule system related to workers that get injured, that is apples and oranges compared to the auto no fault, which was designed specifically for these catastrophic injuries. So I believe in our prior discussion you mentioned that in fact you were a little bit bewildered about legislators being unaware of that important distinction. Could you elaborate on that a little bit?
Yeah, I reached out to a number of our area legislators to try to give them our perspective on the bill and some of the potential pitfalls in what they're currently considering. And I think a lot of them were under some kind of misperceptions. And it was based on information that I think they were getting from outside sources, not the hospitals directly. And so a lot of the folks, as well-intentioned as they are, they just didn't realize that, gee, there's a vast difference between the acuity level of a workers' comp patient versus the acuity level of a trauma patient who comes into our building.
Excellent. Thank you very much. Now, ladies and gentlemen, if you want to get more detailed information, including a legal analysis about this House Bill 4936, again, you can go to dothemath.org. Once you're there, you can read 100 different pieces of information that's available so that when you contact your legislators to object to this bill, you can be much better informed in that process. Now, John, many people have said that this bill will kill tens of thousands of quality healthcare jobs in the #1 growth category for Michigan over the next 20 years. It'll also promote a cost shift through bankruptcy onto Medicaid for our injured citizens from auto accidents, and then impose, strangely enough, a singular regulatory intervention via a fee schedule on healthcare providers. What is wrong with that picture in your perspective?
Well, in the state of Michigan right now, the number one job is jobs. And to remove jobs because of collateral damage from a House bill, especially in the healthcare environment, doesn't make any sense. There's no logic to that. So we're fighting something that's illogical. So it's very difficult to kind of pin this down. So we had a couple research projects done just to show how many jobs are going to be lost in the state of Michigan. In the post-acute side, that's not including the hospital side. There's 5,000 jobs in the state of Michigan that would be lost because of this House bill in the post-acute healthcare market. That would be much larger when you take that out into the hospital setting, and that's the biggest problem with this bill. There's collateral damage that they're not taking into account. When you shift it from the private, which is how we have it now, auto no fault, everything goes through the private side of healthcare, and you shift it over to the public side, you're going into Medicaid. And everyone thinks that's a fine idea. They think it's a great idea. But they've never run a hospital. Now, if they've run a hospital, they'd know that you can't run a hospital with just Medicaid money. You have to have a mix of funders and payers. That's just how hospitals
Now, the
work.
reason for that, excuse me for interrupting, but it's an important point, is because hospitals operate at a loss under their Medicaid patients. Isn't that correct?
Yes, they do.
So that's the important distinction, ladies and gentlemen, we want to make on that issue.
Right. Right. So to shift it over to Medicaid puts it all back to the public, back to us. We get to pay more taxes. We get to pay for the same 500 plus people are going to get injured this year, instead of this auto no fault, which is the most wonderful system in the planet. Now it's going to go over to the Medicaid system, so we get to pay for it as the public. And it just doesn't make a whole lot of sense to have that $30 million shift from the private market into the public sector, where we can't already afford our Medicaid payments. I mean, last year they cut the Medicaid budget. And so to further that with higher risk,